Welcome to Health Sciences Update. I'm Taryn Roloff, Director of Communications for WSU Spokane Health Sciences. And joining me today is Dr. Cindy Corbett, who is the Associate Dean for Research and a professor in the College of Nursing. Welcome.
Thank you. Thank you.
So let's talk about your research. You've been here in the College of Nursing for many years, and you are really well-respected researcher. And so let's hear a little bit about the efforts to improve chronic illness, self-management, and patient safety.
Sure. So my interest from that stems, of course, from my clinical work as a nurse, and really much of my work was in home health care. And in home health care, we primarily get people that have chronic conditions, multiple chronic conditions, generally older adults. And it always struck me that, wow, they need a lot of help. And sometimes I think that as health professionals, we don't offer the self-management support that we should. We maybe say you should do this, recommend that you should do this or that. But for people that don't have a healthcare background, it's very overwhelming at times, especially as they get more chronic illnesses on top of one another, more medications, more healthcare professionals telling them different things to do for different conditions. And so I've always felt that there's probably ways that we could figure out to do this better and to better support patients with chronic conditions. So throughout my career since I received my PhD, I've really focused on doing research, clinical research with patients who have chronic conditions to try to find out ways that we can either help them be better self-managers or make changes to the healthcare system so that they're able to be supported better.
So what are some, and including the safe use of medications, right?
Yeah.
So what are some examples like medications that you've affected?
Sure. So again, being a home health care nurse, one of the things that we saw routinely, most of the time people come into home health care as they are discharged from the hospital. And one of the things that we saw routinely was that patients, needed lots of help figuring out what medicines they're supposed to be taking once they're discharged from the hospital. As you might know, if you've had any family members that are hospitalized, or perhaps even yourself, you go into the hospital and they change your medicines around. Sometimes it's the same medicine under a different name, the same class of medicine, but you get that on your discharge paperwork, and then you get home and you don't know, am I supposed to keep taking this medicine or should I substitute this medicine? Or you go to the pharmacy on the way home and they don't have the medicine for you to pick up. So we just saw lots and lots of problems with medicines. So that was one of the things we started to work on in collaboration with some local healthcare organizations here. Providence and Providence VNA we worked on doing interventions that nurses could do to help patients better manage their medicines. And then we also started looking not only once they got home, but even before they got home, and how could we make that transition better so people had a better knowledge and better able to use their medicines once they got home, because medication errors and misinformation about medicines tend to be one of the most common adverse events that people encounter in healthcare and during that transitional period from one setting to another.
So your research uncovers strategies to help people with this transition.
Good
right.
summary.
Okay.
Yeah, strategies, and usually strategies, and then really what ways can we better teach patients, and how often do we have to do that? Again, I think sometimes it's the fact that we just tell them once and we think they should know it now. And that's usually not the way any of us learn anything, is to hear something once and then we just go ahead and do it. So the fact that they really need more ongoing support and reinforcement.
In your research, did you talk to patients after they had checked out of the hospital and ask them questions about how that transition went, or how did you do that?
We did do that, yes. One of the studies we had that was funded by the Agency for Healthcare Research and Quality was to talk to not only patients, but their family members, healthcare professionals of all disciplines, social workers, nurses, physicians, pharmacists, to see what do they think goes wrong during those transition periods, and how could that be improved upon from multiple different perspectives. And then at the end of that, we got people from all of those different groups together and kind of came up with strategies that could be used system-wide throughout the care continuum.
Very good. So I made a note that says as much as 75% of the nation's healthcare dollars goes towards the treatment of chronic diseases such as diabetes and heart disease, yet outcomes and care satisfaction in those patients are less than optimal. So talk about your recent NIH-funded study to improve chronic care management.
Sure. So that is true. So 75%, some people say that. I just saw something that came out from the Agency for Healthcare Research and Quality that said 66%. So it's, but it's a a very substantial number. And again, it's a lot of times due to these multiple chronic conditions that people are not self-managing well. So this study was a specific call from the National Institute of Aging. They requested kind of unusual partnerships from a healthcare perspective, in that they wanted community-based partnerships and not just like a community-based healthcare organization, but maybe more social services or supportive organizations. One of those agencies was the Area Agency on Aging, and that particular organization locally came to WSU actually through John Roll, who was then the Associate Dean for Research at the College of Nursing, and because somebody that worked there knew him, and they said, we're looking for a research partner because we think we have a great idea to apply for this grant, but we don't have the research expertise. And so John thought that it was perhaps related to the research that I do for chronic care and looking at strategies to help people with chronic conditions and prevent hospitalizations. And so he introduced us, and we wrote the grant, and we also wrote it in collaboration with the Community Health Association of Spokane, which is a federally qualified health care center, and they are providing us with, they provided us, I should say, because we're done with enrollment now, but they provided us with names of people who would qualify, who had multiple chronic conditions, and they also had a fairly high acute care utilization rate. So people that we thought, again, might need this support for their chronic conditions to be able to better self-manage their conditions. And one of the strategies that we wanted to employ was, how can we help patients think about what their goals are for their own health or their lives in general? Because usually if somebody has diabetes, for instance, they don't just tell you, my goal is to keep my diabetes my blood sugar control at a certain level. They will say things like, I want to be able to go to my grandchild's wedding or something like that. But in order to do that, they have to manage their health in a way that will allow them to continue to do those activities. So we have, in that study, there's a nurse and a social worker who are from the Area Agency on Aging that are sort of now embedded within the CHAS organization, Community Health Association of Spokane, and they are doing care management with half of our participants who are randomized to get the intervention, and the other half are getting mostly routine care. We sort of call them every couple months to say, check in, how are you doing, sort of a small, what we call an attention control intervention for that other group. But these nurse and the social worker then really work with them fairly intensively over a year's time to see if it'll make a difference in terms of how empowered or activated they feel in engaging in their own health care. And then we're also measuring, do they actually use less acute care services, since that's where the majority of the healthcare expense can be, is when people have to actually go to the hospital or the emergency room or even urgent care.
Right.
If we can keep them managed in the community through primary care providers or specialty providers, it's a lot less expensive than when they're hospitalized, of course.
All right. So believe it or not, we're about out of time, but as I said when we first started, you're a well-respected researcher and professor here in the College of Nursing, and I understand you were just recognized as one of 4 inductees into the Western Academy of Nurses at the Western Institute of Nursing Conference. So
yes.
Congratulations
Thank you.
To you on that.
Thank you.
Just 10 seconds to tell us what you're most proud of in your career here in the College of Nursing.
Thanks. That's a hard question, I think. I think one of the great things about nursing is you can do so many different things throughout your career. And so one of the things that I think has been really great for me is to progressively make what I hope is more of a difference to more people's lives. So through initially caring for individual patients and families, and then teaching students who will be future healthcare providers, and then doing research that maybe will impact lots and lots of people through policy changes and such, and now also teaching students who will do research in the future that may do that. So I think that, kind of progressively seeing how many people that you might be able to impact throughout your career is probably one thing that I'm really happy about.
Absolutely.
Yeah.
Well, thank you so much for being here.
Thank you.
And thank you for joining us on this edition of Health Sciences Update.